let's talk about some health benefits when it comes to breastfeeding. What are they?
Well, for the mother or the baby?
Well, let's say both. Why not?
Okay.
Well,
So,
we're going to talk more in depth about it, but let's start with the baby.
Okay. So with the baby, the breast milk helps them with respiratory infections, ear infections, and also with bouts of diarrhea, which, it coats their throat, their lungs, and, their stomachs.
Okay. We have some myths or facts that I love always sharing with our viewers. This is a very common one, so you could tell me if it's true or false. Breastfeeding can help you burn off some of that baby weight.
That is true.
That is so true. That's not a myth. That's actually very true, isn't it?
That is very true, because your body works very hard in order to produce milk.
Now, how long should a mother breastfeed her child? Oh, what do you think is the typical?
Well, recommended is a minimum of 6 months, but ideally you should want to do it for a year.
And how important is that initial contact, would you say, when the baby's born?
It's very important, because the moment they come out, they're kind of detached from their home. So it kind of stabilizes their vital signs, and it helps with bonding, and it also helps with your milk production and, of course, breastfeeding.
So when the baby is born, is that production already happening immediately? Do you have to wait a few days? I mean, I kind of remember. I have great stories about how big I was. But do you have to wait a few days, or is that kind of like an instant?
Well, the
production?
colostrum is the first 3 days, and then as long as you're continuing putting the baby on the breast and stimulating yourself, then your milk should come in by 3 to 5 days, depending on whether you had a vaginal or a C-section.
All right. And we talked a little bit about certain illnesses that are prevented, if you will, when you breastfeed. A lot has to do with that GI tract of the baby, right?
Right, yeah, because the colostrum has a lot of immunoglobulins and antibodies that help them against infections.
All right. When does the colostrum just start immediately, like as soon as you give birth?
Well, there's some moms that actually start lactating like the month before, and they tell me that they've had milk coming out. I know.
Really?
Which they're very annoyed about it, but I mean, it's so awesome to hear that, because that means they're gonna do great.
So literally a month before they're already
like leaking. I mean, they're not like full on, breast milk, but they're still waking up a little drenched.